For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Somebody's phone here. Good morning, everybody. My name is Ricardo Romero Morales. I'm Lead Public Information Officer with the County of Santa Clara. Today we're here to announce the opening of a new vaccination site at the Aloha Roller Rink. Today we're also honored to be here with the following speakers. Supervisor Cindy Chavez from the County of Santa Clara Board of Supervisors. Dr. Neeraj Siegel, Chief Medical Officer from the Stanford Health Care. Dr. Bonnie Maldonado, Chief Division Pediatric Infectious Disease from Stanford University School of Medicine. Dr. Rocio Luna, Deputy County Executive of County of Santa Clara. Luis Ruiz, owner of Aloha Roller Rink. Councilmember Sylvia Arenas from City of San Jose, District 8. Councilmember Maya Esparza from City of San Jose, District 7. Councilmember Magdalena Carrasco, City of San Jose, District 5. We also have Father Jon Pedigo, Director of Advocacy and Community Engagement from Catholic Charities. We will start this press conference in English. Today we do not have American Sign Language, but we will be uploading a video with American Sign Language after the press conference. We will then move into questions and answers, in where each speaker will repeat the questions for the purposes of our Facebook Live audience. After that, we will be moving into a Spanish segment of the press conference, where we also going to have speakers in Spanish. We will then move into Vietnamese, Chinese, and Tagalog statements from the podium. Without any further ado, it is my honor to introduce Supervisor Cindy Chavez.
Well, thank you, everyone. And today is really a glorious day in our fight against COVID-19. I want to start by just talking about partnerships. And sometimes when we say that, it just kind of rolls off and people think, well, that's not that big a deal. But I want to talk specifically about how we got here today. In about 3 weeks ago, I saw an article that said that Stanford had received some resources to be able to expand their clinics. And so I reached out and I called the president of the university, and he called the president of the dean of the School of Medicine, and the dean of the School of Medicine called the Stanford director, David Entwistle, and said, hey, what can we do to help? And the ironic thing is they didn't actually have any money. I just thought they did. And when I reached out, I said, look, here's the situation. We have got to expand further into the communities that are hardest hit. And I don't need to tell you why. But for all of you, let me just say why it matters. The area that we're in, and my council colleagues will talk a little bit more about this, but the area that we're in has the highest rates of COVID positivity in the entire county. One of the census tracts not too far out in this area has almost 15% COVID positivity rate. Now I want to relate that to some parts of the county that have as low as 2%, 15%. So when I talked to David, I said, we need your help. And he said, we are in. He didn't ask me how. He didn't ask me what I was going to give him. He just said, we're in. The second thing he said to me was, let's get everybody on the phone at the same time in a meeting. That way we can demonstrate to all of our community how important this is. So what we did is we brought together the leadership of the county through Dr. Smith and Dr. Rocio Luna. We brought together the City of San Jose. The city manager's office there was there with Lee Wilcox and Mayor Liccardo, along with David Entwistle and his leadership team, including Dr. Segal, who wanted so much to make this happen. So let me say why, just what the what is. We're going to start out slow here with 500 vaccines a day. And the reason we're doing that is we're going to get people used to it. But you can see people are already excited. You can see how many people are out here. And as more vaccines become available, we're going to continue to use these pipelines to get as much vaccine into people's arms as possible. So we're in a kind of a teeter-totter, which is we're building the infrastructure while we're waiting for that vaccine to get here. I just want to wrap up with this last comment. You know, there are people who are part of our community, and I would say this is true in many places, that are anxious to get vaccinated and some that are fearful. It's our job, the County of Santa Clara, Stanford, the City of San Jose, it's our job to make it so easy for people to take care of themselves and their families. Eastridge is one of those opportunities to make sure that we're making it easy for people to do what is healthy for themselves and their families. So with that, I'm really excited and honored to get to invite up Dr. Segal, the Chief Medical Officer for Stanford Health Care.
Thank you, Supervisor Chavez. Good morning, everyone. It is indeed a joy to be here today. It's also hard to stand here and not reflect for a moment on where we were a year ago. This is almost to the day when California had been declared a state of emergency. California had had its first death reported from coronavirus. And for many of us in hospital systems, we were standing up our command centers to manage what was an overwhelming amount of uncertainty, fear, and anxiety that we've all lived through. The pandemic has certainly taught lots of lessons. I'll highlight 3 for the purposes and relevance of today. The first one is one that Supervisor Chavez already alluded to, which is we've learned how critical partnerships are, the ability and the interdependencies between hospital systems, county public health departments, cities, and most importantly, the community to really help combat the coronavirus and what everyone has been impacted by this past year. The second lesson has been the highlight of health equity. And so for many of us, this of course is not a new problem. It's just the coronavirus has helped put it in the headlines and has given us a collective societal call to action that I hope we continue working towards long beyond the pandemic. And the third, we've learned that we can't have enough kindness and compassion for each other on a daily basis. We all need it. It's been an incredibly difficult year for everybody, which is why today, on behalf of Stanford, we're so humbled and grateful to be here in partnership with the City of San Jose, the County of Santa Clara, and most importantly, the community members here who are allowing us to be part of the solution to help provide equitable vaccine. And I'll end my remarks just on a personal note, which is the team you see behind, who has been working tirelessly the last couple of weeks to have this set up, to build capacity so when we have vaccine supply, we can continue ramping up how much we can vaccinate. I can't tell you how meaningful it is for all of our teams. This morning at one of the final follow-up huddles of getting ready with the last details, there was a lot of emotion on the call. I think many of our team would tell you that this is amongst the most meaningful work they've had an opportunity to do. There was a lot of emotion around the opportunity to help be part of the solution here in the community. And I just can't state how excited we are and thrilled we are to be partners with the community here and the leadership in front to help serve this community in ways that they need. So thank you, and we look forward to giving you updates as the week goes forward.
Go ahead. We're going to let everybody introduce themselves. Go ahead, Doctor.
Good morning, and thank you for inviting me here. My name is Bonnie Maldonado, and I'm a professor of global health and infectious diseases. I'm a pediatrician and an epidemiologist at Stanford University. And I am so honored and excited to be here today. As Dr. Segal said, it almost brings tears to my eyes to see this wonderful facility and the access that it will bring to our communities. I've been following this pandemic since January 1st of last year, when it first started to raise concerns among the epidemiology community. And I can tell you that as a pediatrician, a teacher, and a scientist, that I have been studying this virus since the very beginning. I have been to all of the CDC and FDA meetings. I have looked at the data. I have studied it myself. And I have to tell you in very clear fashion, this is a very safe set of vaccines. These vaccines are highly effective, and they are going to be the way that we can get out of the last 15 months of the most challenging and distressing times of our lives. These are the way that we are going to be able to end this pandemic. But the only way we can do that is this: everybody has access to these vaccines. If everybody has access to education in the language and the culture that they understand, we as providers, as teachers, as scientists, we must do that for people. My entire career I have spent supporting the health and safety of children and their families in the United States and around the world. And I can say that on behalf of my colleagues at Stanford and Stanford Children's Health, we are committed to helping all of you do that as well. And this is a wonderful example of how we are going to be able to reach all of our communities and end this pandemic. So I'd like to thank you all now for inviting me again.
Thank you, Dr. Maldonado.
Good morning. My name is Rocio Luna. I'm a Deputy County Executive with the County of Santa Clara. This county is thrilled today to be partnering with Stanford Health Care to lower the barriers to vaccine right here in East San José. This site here, the Aloha Roller Rink, will be a huge added resource for this community. Today we want to acknowledge Stanford Health Care's leadership by answering the call to provide equitable access to vaccine throughout the County of Santa Clara. Our county continues to employ a multifaceted strategy to ensure that vaccine is reaching the hardest hit communities. This site here builds on existing sites in East San José, including the Emmanuel Baptist Church, the fairgrounds, our hub at Story Road, our partnership with Gardner Family Health Services at the Mexican Heritage Plaza, and pop-up clinics at school sites and throughout the communities. Today, actually, our mobile vaccine team is out at Christopher Ranch, one of our largest agricultural employers in this county, vaccinating farm workers. We also have a huge number of educators who are getting their vaccines today at the Levi Stadium and at the fairgrounds. Every day we have outreach workers and promotoras in neighborhoods to inform our community about the vaccines, helping them schedule appointments and to learn about drop-in locations. Our county is doing everything possible to ensure that we have equitable distribution of vaccine and that we're getting vaccine into arms. Our efforts to work with our communities to get vaccine into the most impacted communities are succeeding, but this progress is jeopardized by challenges with supply from the state. The county received less than the anticipated allotment this week, and the state has not offered an estimate of doses moving forward. We're doing everything we can to make sure that we continue vaccinating the community, but the county health system is now fully booked for appointments next week due to these shortages. We stand ready to expand appointment capacity as soon as the state provides additional vaccine supply. Thank you for being here today, and once again, I'm so happy to be here to celebrate the launch of another vaccine site here in the east side of San Jose. Please remember that as we wait for the vaccine rollout to our entire community, please continue to wear your mask, maintain social distance, and get vaccinated when it's your turn. As more activities open up in the red tier, please consider also that just because it's something that's allowed by the state, it's not necessarily safe. Please consider the safety of yourself, your family, and your community as you make choices about activities. Thank you for being here today.
Hello, my name is Liz Ruiz, and I am the owner of Aloha Roller Rink. Thank you. I am so excited to be here. This is a great opportunity for me. I started this business to serve the community. We were losing our very last roller skating rink in San Jose, and I stepped in and bought the fleet of skates so that we could preserve that for everybody. And I opened at first at Roosevelt Park, and then I had the amazing opportunity to come here to Eastridge, who has been a fantastic partner. So we have built a wonderful thing. We've only been here 2 years, one of them open, one of them shut. As a business that is in the yellow tier, the very last tier to open, it has been a struggle. It has been hard. But I am so glad to be able to have this opportunity to continue serving all of the Bay Area by partnering with Stanford and the county and using my empty space to help everyone come and get their vaccine shots. You know, I recognize that the more that we help you guys get to your vaccine levels that we need, then the sooner we will get to that yellow tier and I will be able to open again. So that is what I am looking forward to, being able to serve the community and keep going in this fashion. So thank you so much for letting me help you guys create what I am calling the most fun vaccination site in all of California. So thank you so much. We have Sylvia next to talk, our city councilwoman.
Well, Liz, I didn't bring my skates, but I promise to do so when it's my turn. Good morning, everyone. I'm Sylvia. I'm the council member that proudly represents this district. So welcome to Eastridge. Welcome to Aloha Roller Rink. This is 95122. And just a little bit about my community. I share it with my council colleagues, Councilmember Esparza and Councilmember Carrasco. We share the beauty of this community, which is 95122, but we also share some of the challenges of our community. And 95122 is about the same size in terms of population as the city of Gilroy. That's how dense it is. That's how overcrowded it is. But it's a lively community, and it's a community also that has been struggling in COVID infection, death rates, poverty, crime, and that's why I'm so relieved that Stanford Health Care has decided to come here. We all advocated, and thank you so much, Supervisor Cindy Chavez, Jeff Smith, our county executive, Dr. Rocio Luna, Deputy County Executive, Dr. Niraj Sagal, who you heard earlier, as well as Dr. Bonnie Maldonado, Chief Division of Pediatric Infectious Diseases. All of them have made this day possible. And as we see behind us, this line is going by pretty quickly. And I was speaking to somebody in line, I think they were like fifth or something in that order. And she said this was the third site. This was the third site that she had visited this morning. And that the earlier two sites, she had gone as early as 7 in the morning, and they had already maxed out. So our community wants this vaccine. Our community needs this vaccine. But I'm going to speak to those who have not decided just yet whether they're going to have this vaccine or not. And I'm going to say that this is the vaccine that has achieved greater diversity than in many previous trials for other drugs. So that means Black, brown, Asian, just people of color participated at a higher rate in vaccine trials. And those volunteers helped us make sure that this was one safe and an effective vaccine. So the trial is over, everyone. This has been proven to be effective and safe. So for those of you who are still on the sidelines waiting to decide, just going to share personally, I was also battling COVID in December, along with some of my family members that include my mother-in-law, who's 75, who just turned 75 last week. And she also has received the vaccine 2 weeks ago. She's part of one of my most loved family members, and I would never recommend something to a family member that wasn't safe and effective. So please, if you haven't decided, please come by Monday through Friday. We're here at the Aloha Roller Rink. Bring your skates. That's optional. Thank you, everyone. Going this way.
Well, roller skates are optional. Okay. My name is Maya Esparza. I represent District 7 and share 95122 with my colleague, Councilmember Arenas. And you're going to hear from the East Sider contingent. The three of us are here, and my colleague, Councilmember Carrasco. I really want to thank the leadership of County Supervisor Cindy Chavez, who represents all of us and the county and Stanford Health Clinics, for giving this opportunity to this community today. The folks have been lined up. I don't know if anybody saw, but they're lined up all the way down out there. And I also spoke with some people in line who waited for 2 hours to get to this point. We had childcare workers and food workers that I spoke with who want the vaccine. Our community wants this. There is no doubt. And this is a community that has faced a number of challenges. So I actually call on the state to give our county and our community the vaccines that we need for the community that so obviously wants it. And understand that vaccines are the key to reopening our economy. The Aloha Roller Rink can be open one day. Our schools, and most importantly, protecting the health and safety of all of our communities. This Aloha Vaccination Center, the most fun vaccination center in our county, provides an accessible location for all of the East Side. East Siders have grown up coming to this shopping center. We've grown up coming here. This is a perfect site, and this is an important step in removing the barriers for our community who so desperately needs this vaccine. Thank you. And next we have Councilmember Magdalena Carrasco.
Thank you so much, and I'm the third of the contingency that represents the East Side, and couldn't be prouder to be here today. There's so much that has already been said. I don't need to repeat it. Other than this, on the east side of San Jose, as you've heard, this is the bulk of your essential workers. This is the bulk also of your COVID-19 cases, and this is also where we're losing many of our precious lives. I'm so grateful. There are so many people to thank, but I have to give a huge shout out to the city of San Jose who's been pushing, and to our county board of supervisors, especially to our fearless leader, Cindy Chavez. This site has been empty, unfortunately, due to COVID. And now beautiful Liz has partnered with us in a very creative way. And I want to focus on the importance of partnership and collaboration. If we're going to truly save lives, if we're going to put an end to sheltering in place, and we're going to truly open our economy, get kids back to school full time, and get back to what was our normal lives, collaboration and cooperation is the key. And I think that at the end of all of this, Santa Clara County is going to be seen as a model for how it's done. When you see private partnerships, county, city, and not, by the way, we are also standing in the busiest transit hub, and VTA has offered free rides to anyone who's going to a vaccine site. This is the way it's done. This is the way we're going to save lives. In addition to that, I want to emphasize, besides opening up the vaccine sites, the city of San Jose and the county is investing incredible human capital and funds to make sure that we get to the most vulnerable community members. They're going door to door, not only informing people, but also registering people so that they can get their vaccines. Again, so many people to thank, but I have to just make sure that I acknowledge my council colleagues. They have been fearless at the council dais, and my supervisor. They understand what's at stake. They understand whose lives are about to really be in jeopardy if we don't push. And I want to make sure that I get this message across. If we don't get our essential workers, those who feed us, those who make sure that we can shelter in place, those who make sure that our children are safe in schools, who are fed in schools, who keep our buildings clean, who have continued to work during the pandemic, we're never going to completely reopen the economy. So I want to thank everyone who's been here, who's made sure that we have the sites right where we need them in the community, accessible and available to those who most need it during this most difficult time. We've never seen a global health crisis like the one that we're seeing now. Thank you so much for your leadership, and thank you so much, Liz. I knew Liz when. And so Liz, thank you so much, because the generosity that you're demonstrating is truly remarkable. And to be able to pivot and to be able to be creative with your spaces is what we're asking the community to be able to do during this time. So I really appreciate it.
Thank you. Yep.
We're going to do it all in English?
You're bringing us home, Father John.
Oh my God. We're going to do it in English, then we're going to do it in Spanish?
Just English, and then we'll do Spanish.
Híjole, Dios mío. Hi, I'm Father Jon Pedigo, Catholic Charities of Santa Clara County. And it's a moral obligation to get vaccinated. And that's not just me saying it, that's from the Pope. It's a moral obligation that we get vaccinated. And it's not just for ourselves, but really it's for our neighbors. And at this time, I'm here also to, speaking out of the interfaith community, from the Catholic community, from the Latino community. What we can't do is we can't allow the politicization and the gentrification of the vaccine. Now, we can't allow the politicization with comments about false posturing that serve nothing other than furthering the agenda of people trying to undermine the confidence in the vaccine itself. So I want to say to those people that are standing on the edge, should they get vaccine or what, are going to wait for the right vaccine, get vaccinated however you can, when you can do it. Now, I want to thank the county, Supervisor Chavez, the Stanford Health, and all the people that made this possible, the council members here, especially on behalf of the Latino families that we serve in this community, in this zip code. We're very active in this zip code, 95122, 95111, 127. We're in all of these zip codes that are the hardest hit, where our own workers and our families are literally dying from this disease. But we also recognize it's really important, and we're thankful that we're recognizing essential workers who need the protection of the workplace. The people in this community live in overcrowded conditions. They don't have the luxury that many other zip codes have to protect themselves. So this is the reality that we're dealing with. Many of our community members do not have regular health care. They don't have they have to work several jobs, and so they don't have a lot of time to take an entire day off from work to get vaccinated for 2 times. So sometimes they can only get the type of vaccine that happens just once. So this is kind of what we're dealing with this. We also recognize, and we are very thankful, that we're making an effort to place these vaccines in our hardest hit communities, especially in our Latino communities, which have been for several years fearful of deportation and terrorized by comments. And now it's important that we have this partnership with community, government, and clinics to make this possible, that we can work together. So I want to thank everybody that we are moving towards greater equitable access to the vaccine for all of our communities. And I want to thank, again, all of you for being part of this. Gracias a todos.
Before moving into our Spanish section of our event, we will take questions in English for our speakers. That will include Dr. Marty Fenstersheib, who is here. Please identify who your question is for, and we'll start with KPIX.
People are working the system and getting the vaccine at that time, because it doesn't seem like there's a lot of ID checks going on. Pretty much those folks who are getting the system, getting something.
So the question was, what do we say to people who are gaming the system and who are getting ahead of other people who really need the vaccine? First of all, I would just say that this is, when you're cutting in line, you're cutting in front of somebody's grandmother. You're cutting in front of somebody who's trying to go back and teach. You're cutting in front of somebody who's at a grocery store, who's interacting with people day in and day out. You're cutting in front of somebody who's transit dependent and could only get here, as was described earlier, that took a bunch of different tries to get here. And what I want to say to people is, I know people are scared. I'm actually really excited that people want to be vaccinated. And we're going to work really hard with the state to make sure we get those vaccines, and we're going to get to everybody. But we don't want to cut in line because we're risking someone else's life.
KTVU?
I have a question for Dr. Marty.
Dr. Marty.
We're hearing, this is from Ann Rubin. We're hearing that the county received less Moderna vaccine than expected. How short are you, and will this impact people's vaccination? And the other question is, how many people are in the
So that all has to do with the allocations that we're getting. I would say that the allocations that we've been getting have been pretty flat. And because of the doses a dose, we basically haven't been holding back second doses. So we depend on the vaccine that we're getting. We did just start getting the Johnson & Johnson vaccine, so they added that to our allocation, and that made it look like we were pretty flat, but we didn't get enough Moderna vaccine. So we are basically looking through all of our inventory, moving things around, talking to our other partners in the community to at least make sure that all of those people who got a first dose get a second dose on time. That is our priority. So please, if you are waiting for your second dose, that will be available for you. We will have to wait for additional vaccines, though, to add additional first appointments for people. So it's kind of hit and miss right now, and we're just begging the state to provide vaccine like we've said that we need for this community, and we're hoping to get more over time.
Are appointments being canceled or delayed?
Some, we are trying to honor all of the appointments that have already been made, but again, if people are looking for new appointments because that all of the other sites are booked up, they may have to wait a bit for us to open up additional appointments. So most of the providers are not opening up new appointments, but we're trying to honor all those that are already appointed and not cancel any of the appointments.
NBC?
Yeah. So we are really trying to increase our capacity, knowing that we don't have enough vaccine. So even though we're increasing our capacity, we're hoping that down the road that we will have additional vaccine. It's not enough right now. We have great capacity, and we're probably not only doing maybe a half of what our capacity is at this point. So there's nothing that we have no control over the amount of vaccine that comes. We're hoping, again, that the federal government will provide more and that the state, again, through the new network of systems, through the Blue Shield system, that we will get the vaccine we need. But basically, we have no control over it. It is a supply crisis. Absolutely. This is all of the issues we're dealing with, I call a supply and demand. If we had plenty of supply, we wouldn't have any of these issues. So it's a critical issue that we are not getting the supply, even though the demand is as high as it is.
KCBS?
Yeah, I don't know whether it's a production or not. Or we're listening to the federal government and hearing that we should get enough vaccine by the end of May. So we're hoping and holding on that promise that we'll have enough vaccine. So we just want to make sure that everybody, again, is patient, wait your turn, and please stay safe while you're waiting for your turn.
KCBS?
Yeah. So the question is about people gaming the line. There's always going to be people that do that, and we know that. But the key that we wanted to make very clear is that we don't want to put up barriers to the people that are there. And so we are not asking for all of those types of documentations, but we are asking people to sign an attestation. So we're depending on people being truthful in our community, knowing that some will not. And so we're not going to let the good get in. We're not going to let the perfect get in the way of the good.
Final question, English Bay City News.
Yeah. Again, how much vaccine? We have no idea what we're going to get. It comes in week by week. And so we have a meeting every Thursday with all of the providers to tell them what we know and how much vaccine everybody is getting. We got about 7,500 doses of J&J, Johnson & Johnson vaccine for this week. We got less of the Moderna and Pfizer than we got last week. So again, it's also important to remember that we have to give the same vaccine to you for your second dose. So we can't start a new vaccine manufacturer for the people that have already gotten a different one.
And we are going to close out with KTVU for one final.
I don't mean to take over.
That's good.
I would say that's all of us here's job because, it's everybody's job to put pressure on our leadership, the federal level and absolutely the state level, to say that we need more vaccine because we're ready for it. We've got the infrastructure and send us the vaccine. So we should all make a call, should I say it, to the governor's office and say, we need this vaccine.
Yeah, and I'm also, can I just wrap up with that? Because I don't want to have anybody mad at Dr. Marty. Because we all love Dr. Marty. But let me just make a really important point here. That we're counting on the state to make sure that every county in the state of California has the resources they need to get vaccines in people's arms. And I want to emphasize something, and I'm going to ask Maya just to close up with this point, that we have really high need populations here, and those high need populations need to get vaccinated. And we're doing this. We have 100 people going door to door, signing people up. We're putting pop-up sites. We're doing everything that can be done to make this accessible. But we need the state to treat all of us fairly and to make sure that as they're asking us to expand this infrastructure, that they're getting us the vaccines that we need. And so part of what I'm saying is that we're calling on the state, we're calling on the governor, we're calling on the president to continue to focus on production and getting the vaccines out to us as soon as possible. In Santa Clara County, we're ready. Within 3 weeks, we could go up to being able to serve 125,000 people a week. That's what we have the capacity to do here. We're just waiting for the vaccine. But I want Maya to have the last word on this, and then we'll switch. We'll switch.
I think I know what she wants me to say, and that is, Governor Newsom, give us vaccines. You're standing in the hardest hit zip code in all of Santa Clara County. The governor recently set aside 40% of the state's vaccine supplies for 400 zip codes in California that represent low-income, hard-hit communities. Not one of those zip codes is in Santa Clara County, much less the city of San Jose. So that means less for this zip code, that we need our allocations. You can see our people want this vaccine. They've been waiting in line for 2 hours just for the chance to get a vaccine. So I call on the state to allocate us the resources to help us serve our community and the community that has been hardest hit and needs this help. Thank you.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.